questions that they might ask again, to the like surveyors ask the patients, and they always ask them stuff like, "Are your needs being met? Did they discuss the plan of care with you?" So every visit you go there, just ask them if whatever. First, whatever is on the plan of care, they need to know what they're gonna get, right? The care they're gonna get, and they need to be part of that. So just making sure that they understand that they are part of the plan of care, because most patients, they trust us to develop a plan of care for them, but they need to be involved. So just making sure that they understand that if the surveyor were to ask them, were you part of the plan care making, they answer yes. So when you're doing your SOC or your follow-up visits, you can always ask, is there anything in the care plan or anything with our care that you would like your personal goal? So they feel involved. Most patients are like, I'm fine with the way it is, but if you constantly ask them, then when the surveyor asks them, they are gonna answer yes, not like, oh, this is the first time they're hearing about this. So another thing they can ask them is, are you satisfied with the care? This is a question they ask often. So you, every time you're in there, the last thing is, are you satisfied with everything so far with our agency? And if there's a concern or whatever, then you can bring it up with Buizo so we can tackle that, because they will definitely uh, ask, and make it a routine to document the discussion that with the satisfaction. So in your note, you could put like a little thing, discuss the patient is satisfied with the care, has no complaints, or blah blah blah. Um, we talked about this again. Meds are super important. Make sure every visit you ask them, make sure that they haven't got a new medication. If they have, even if you're doing physical therapy, let the office know. That's really, really important. Um, Especially with the startup cares, are you discussing them with them how they, if they had a complaint, are you educating them where they would call and who they would call, the phone numbers?
I just tell them
This number. Also, you gotta let them know of the, I don't know where it is in here.
I didn't go back.
I think it's on the
It's in the complaint process is in here. The state and the
Oh, to the ombudsman.
yeah, yeah. If they have a
Right in the
complaint.
inside.
That's another thing they always ask during the visits. Like, did the agency tell you how, if you had a complaint, who and where to contact? So you guys regularly ask questions like that? Like, are you satisfied with the care? Are your care needs being met? Okay. And if somebody had a complaint, like for example, um, let's say physical therapy went in and they said, you know what, I like the care, but the nurse is always 20 minutes late. What would you do in that situation?
I'll just call the office.
Just let them know, yeah. It's not snitching. You're not, being a. You're at the end of the day, as an agency, you want to give the best care. So you want to keep the patients happy, and you're not calling to get your fellow colleague in trouble. It's just part of our quality assurance. Is let the office know that if maybe the nurse is giving them an exact time, and sometimes you tell them I'll be there at 10, and you're there at 10:15, and they're like, you know, their whole folks are just sitting there looking at the time. So give them like a timeline, whatever. But
And between 1 to 2 hours.
I would always say 2 hours. Like I'll be there between 10 and 12. But again, people are. My point is, if there is issues, report those complaints so we can tackle those problems and it doesn't progress into a bigger
Because
problem.
if they don't like or have a problem with another clinician, you can tell them. Let the office know, because we can always find somebody.
Yeah, no,
Instead of having problem, with that person.
Sometimes you're in there, you don't wanna be a bad
Yes.
coworker and
Yeah.
get them in trouble, but the point is you're not gonna be, it's more about the patient care than, anybody specific. I know people need to go. So any questions?
Thank you.
The key things to remember for our survey purposes is every patient needs an individualized emergency plan, so try to get as much information from them. We need to know where they're going, who they're going to stay with. You giving a thought about, your personal situation. If something were to happen, would you even be able to help? It's at the end of the day, it's the work you need to report. What would you do with your kids, your family? These are things that you just gotta keep on in the back of your head. Plus, the backup site, CEO's house, and the radio station, the 980 AM.
AM.
These are just the stuff that they can, throw at you and ask you, so you just be prepared to, know. And if you guys want to read the whole plan, just let the office know. We can email you the copy of the emergency plan.
And it's okay to tell them, like, if you don't have an answer, then let me try to call my office. What's the next sequence, or what's the next step to do?
Yeah, and listen, if you say, even if it's something you might really know, but at the moment you're nervous and you forget, just say like,
as long as you have like the steps, proper steps to go to that.
As long as you give it thought, you'll be fine.
Are these like common questions they would ask us for the therapy side?
They can.
Mm-hmm.
Sometimes I've seen they just ask no questions. So hi, nice to meet you. But sometimes they'll ask you like how many kids you have and start having a conversation with you. So I'm just trying to throw out as much as I can, so you're not like caught off guard.
Can you go see Janelle? Get some supplies from Janelle.
Alright, thank you.
Yeah, the questions, these are just stuff that I wrote down that I hear them asking, but especially lately, they keep on asking, are you involved in your care? Were your rights explained to you? Do you know how to file a complaint with the agency? Just if you guys can cover the bases with the patients, that'll be great. And make sure that this folder, that it's not like under the couch or something. It's like sitting somewhere where when the survey comes, they can access it. Do you guys leave the med sheet this one at the home? No, right?
Can we just use the printed one?
Yes. So
Okay, so we'll take that out,
so
the whole thing. Para
so
i-update
you
it.
can so you can use this.
So we don't write it.
So you can use this as your like cheat sheet to write your meds on this, but because you do it and then you put it in Kinzer, right? So there's no point to this.
So even the
So-
one that for the cancer part that they've been giving, can we not upload it? Instead that we just go by with the one that you guys input, right? Because the
I didn't understand the
the hard
question.
copy, yeah.
No. This. So the way I would use this is on the next batch of orders. Just do one. Don't do a double copy. Just do one copy for no carbon copy. Yeah.
Oh, so that's fine. Okay. Anyway,
Yeah.
we still
So you just use this like as
just like a
scratch paper.
correct.
So for instead of them writing on like a white piece of paper, and do you take an iPad with you on the visits or no?
No.
So you write this down and then input it. So then it's it's a nice paper to write it on, but you could shred it afterwards. You don't need to keep
So
it.
my question is, so right now what we're doing is they're gonna write it down, and then they're gonna give it to us, and then we're gonna upload it.
No.
So we don't need to do that anymore.
then
Whatever they wrote it
Yeah,
there.
this is basically the nurses.
Because that's why that we're having a discrepancy sometimes, because that one is not complete and then the other one, so we keep writing it.
So your main medication profile is gonna be the
On the
one in
Kinzer.
Kinzer, and then just print that out and then the visiting nurse will, you know,
Yeah.
take it in
I think
and
that
put
would
it
be
at the
best.
patient's house. And then if there was a change or something, you update the Kinzer, print a new one and take it. Because then you have Kinzer, it's not,
I know.
yeah.
I know. That's what I wanna answer.
And if you don't wanna use it, you don't have to use it.
Do we leave the printed copies there?
Yes, the printed copy
Even
of
if it's
this.
just like loose?
Yeah, just put it in the book. Yeah. So you need a 485 needs to be at the patient's home and the med profile. And make sure that they both match.
Okay. So I think that's what we're gonna do.
So yeah, this is
Because sometimes it doesn't matter, yung initial lang, no?
Yes.
So we're just gonna, print na lang natin. And then we're not gonna upload it anymore. Because it's a lot of work doing that as well.
yeah, I would definitely not do that.
Yeah, I wanna really ask that to eliminate it. It's not needed. Because, we're having a hard time.
And then do you
Anyways.
guys do you fill this out?
Yeah.
Yeah, okay. It doesn't have to be specific, like as long as, for example, if the nurse is going twice a week, you could just do like Monday, Wednesday. You know what I mean? As long as the patient knows physical therapy, and then physical therapy needs to put their frequency of visits and just put like physical therapy or PT. So just check off physical therapy, the frequency goes there, and put and it could be like, if you put Monday, doesn't mean you have to go Monday. So
In case the PT forgot, can you guys put?
Because you can put the projection, right? Even if you're not gonna go on that day.
so just make sure everybody knows about this.
The meds?
The meds, yeah.
Okay.
The next one you print, you can
So,
you're
Yeah.
the one. Do you think it's helpful to have it or no? As like something to write.
I mean, I can just take pictures of them and just.
Okay, but then you're taking pictures. That's in your phone. That's a HIPAA violation. Yeah.
It's because yesterday.
Don't ever say that in front of a surveyor.
Well, yeah.
Your phone
Hey,
gets
Melissa,
lost.
so next time you just the whole thing tear it up.
Yeah, make sure that. So talk to the nurses, if they don't want to use this, it's not helpful for them, just take it out of the books so it doesn't become a problem, and then when you order again, just don't put it in there. Cause does that make sense or?
Yeah, it does, but what they going to use?
This one.
That one, so we're gonna order that one instead.
No, why would you order that?
Because the
We're
next
not
time we'll
even
not
that. Don't put in the chart. It's whatever's in
I
Kinzer.
know, but I mean,